Yeah. I save lives. Put a lot of time into the court car.
Yeah,
Over here, you guys can save.
are we streaming? I'll wait for Cindy.
Kenny's the size I have dollars.
But where they cop. You know, if you have a 1943. I think it's a copper penny, it's worth. 6 figures, possibly $1 million. If you have stopped making.
There for some reason, Cindy.
It
was stuck down. I couldn't get it over. We're good. It's okay.
I
I just couldn't move and then like, oh yeah, that's right. It's probably stuck.
Manganese or whatever. Yeah, same.
That.
Yep.
8 known to exist or something like that. I don't think.
It is 9 a.m. So I'm going to call this meeting of the Codington County Board of Commissioners to order. It is Tuesday, November 10th. Nope, Thursday, November 10th, 2022. We'll start with the Pledge of Allegiance, and Cindy, would you lead us today?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, thank you. I would just mention, if you have a cell phone, please make sure it's silenced. If not, or if you need to take a call, step out into the hallway, please. And we are streaming live on YouTube. Item number 2, call for public comment. Public comments may be submitted in person, or we will still accept them via telephone. The 2 numbers are 605-882-6248 or 605-882-6297. And we will, these are items that are not on the agenda and for information only. We will address those during the open part of our meeting.
Madam Chair, just think if the Zoom goes offline, we'll just restart it again. So if
Okay.
people are watching on YouTube, just be patient. We'll come back.
Okay, sounds good. Item number 3, conflict of interest items. Are there any for fellow commissioners?
No,
No.
All right, item number 4, action to approve the November
moved.
10th, 2022
Second.
agenda. Motion by Van Duzen, second by Gable. All in favor, say aye. Aye. Opposed, that motion carries. Item number 5, action to approve the November 1st, 2022 minutes of the Codington County Board of Commissioners.
come on.
Motion by Johnson. Second by Van Duzen. Any additions or corrections? Not hearing any. All in favor, say aye. Aye. Opposed, that motion carries. Monthly reports, Director of Equalization. We'll start with Shauna this morning.
Good morning,
Good
Shauna.
morning, Shauna.
Okay, so our year end basically ended October 31st. And so for the next few months, my monthly report is basically going to be the same. We'll be working on the same things until assessment notices go out March 1st. But we're getting ready to send in our year end sales to Department of Revenue. They reviewed them, and then my intentions will be sent in prior to January 1st. And that basically is just what we're going to be doing with the assessments, the separate neighborhoods. The Department of Revenue looks at both of those together and determines whether or not we're in compliance with where we need to be at as far as at least 85% of market value on our assessments. The appraisers are currently working on building permits and will be doing so for the next few months until we get those done. And then we are still trying to work on getting the summer reappraisal values logged into the computer and cards and things put away. So that is what we'll be doing for the next few months. So.
All right, did you get through all those appraisals that you were hoping to do? This
Yes,
summer?
we got through all the summer reappraisals. And next year I think we'll be on the east side. I'm not sure if we can do the east and west because we basically have just the outlying ones, but we'll see when we get closer.
Very good. Anyone else have any questions?
No questions, but just a comment as a liaison for your department over there. I want to thank you and your staff for a job well done again.
Oh.
I mean, it's a lot of work. A lot of people don't realize everything that goes on behind the scenes over there, but it's a
Yes.
hardworking office and we appreciate
are-
the job you're doing.
Thank you. People are starting to get a little, I don't want to say more crabby, but more vocal about not wanting
Right.
us there, but
Yeah,
we're
Yeah.
we're going through it. The girls, they know what to do, and yeah,
nobody
it's getting scarier. out
Nobody
there,
wants to
but
see an increase. in
No.
anything, so,
Nobody wants to see us.
but We appreciate what you
You
do.
have the fun.
Thank you.
Thank you.
All right.
All right, thanks, Shauna.
Thanks, Shauna.
Let's move on then to the welfare director, and then we have a couple more items on the agenda as well.
Morning.
Good morning.
Morning, Sarah.
Good morning. Thank you. Oh, here. So the Helpline Center has revised our report a little bit. Oh, sorry, true it here.
Printed for myself.
Okay.
I think I
I'm
got.
confused.
Um,
I'll get back to you.
Yes, I am what I need.
There you go.
It's just one sheet, right?
Yeah.
Oh,
Front and back, yep.
okay.
Yeah, but it's front and back now.
Okay.
And we're also, when I was looking at it, getting ready to come, I have some questions about how they're getting where they're pulling the numbers from. So this is what we have, and I will be reviewing it as well. It does identify who we've served each month, the number of services and the total client contacts, which is, I've really been working with my staff to record the individual contacts they're having. So I'm not surprised that that's gone up, because we're trying to keep better track of that. And then at the bottom, the costs and the dollars, again, these are from May. And so when we started doing it, so this is the funeral assistance we have spent for the year. Our funeral costs have been higher this year for that. And then the hours is a newer number, what we're spending our time doing with that.
You said you had a question about where they're pulling their numbers from.
On
What-
the backside.
Okay.
For the case management and not the case management as much, but down at the bottom with the referral sources. The 33 referrals to the Beacon Center in October, Carrie and I were trying to identify where that number is coming from. And so those are some of those. So that section at the bottom is really where I need to do a little bit more digging about where they're getting.
It's a significant increase.
Could some of
Yeah,
some of that be coming directly from their data?
it shouldn't be, it should just be pulling from ours. So I don't know if our staff is entering something in a way they shouldn't be, or if things are just not getting logged in the right thing. But so I think that's just a logging issue.
Mhm.
What do you think about sort of this part here? I mean, we're
Mm.
talking just unique individual. You think that's fairly accurate, the unique individuals?
I think those numbers are fairly accurate with that.
Yeah, because we're looking at a sizable jump there.
I know.
That's significant. It's got to be a coding issue.
Yeah, that's what I think. We're gonna have to review those.
Mhm.
Last month, when you asked me where the coordinated entry system numbers were coming from, I just had a complete brain dead moment. The coordinated entry system is the homeless referral system. And so
Oh,
that's when we send people to make the number to call to receive homeless services, homeless support services. That's where
That would probably be good if they just retitled that for the layman.
Well, yeah,
We're not gonna remember what
Yeah.
that is.
I can, yeah, we can do
Homeless
that.
referral.
Homeless,
Yeah.
yeah,
Should be able to remember that.
yeah. Right, because even I, who work with it all the time, was like, what is that?
So how would you define a service when like looking at the purple bars on the front page?
On the front?
Yeah, when you say services a month.
So that would be typically, I wanted to make sure I'm telling you the right way that they're actually pulling the numbers for, and maybe I need to look at it. So services recorded, like, that would be what services we're providing. So if you go back to the services on the back, the case management, emergency housing care coordination, it would be those services. And I can confirm that that's how they're pulling
So
that
I
number.
would-
So
So
those-
just looking at the numbers, so they don't look super high. So I'm guessing like if you have a case management service, you're
Mm-hmm.
buying somebody, that could be several visits or a visit and a phone call or something like that. Is that?
Yeah, so that's exactly it. Case management is gonna be more involved and
Yeah.
gonna provide a lot more actually individual services.
It's
And
counted
so,
like one thing, maybe,
Mhm.
I'm thinking.
yeah,
So are these numbers duplicated? Like, say example, you have one in case management. Could it also be care coordination, transportation as well, or are these specific per case?
potentially, again, I need to, and I just was telling Carrie, we probably need to have a meeting because they run this report for us. And so I need to figure out from them, now that we've been using it for a few months, we're more familiar with how we put it in. This completed service is based on what we put in that we provided. It's there. And I do think these are probably not replicated as much because
we have to put in what service we're providing. And if we're doing case management, we're probably not putting in some of the other pieces.
Right, because case management could entail rent
Right.
assistance or
Mhm.
transportation
Right,
as well.
the transportation, all of
Yeah.
that, yeah.
Okay.
Several,
Mhm,
one individual could utilize several of these
Mhm.
programs.
mhm.
Oh, that's good.
Yeah, so that, like I said, now that we've been using it for a few months, we're a little bit more familiar with how it is, and so we can refine how we're entering that data. With that, yeah,
It takes a little while to kind of get the groove of it and everybody knows when you're entering it that you're all on the same page.
yeah, right, and that we're doing it consistently across the board. Yep, yeah, and that's working with the staff too.
But if you look down at the completed referrals down at the bottom there, Sarah, you'll notice that some of those months are high. Like 26 completed referrals to the Salvation Army in July of 22, 36 to Social Security in August.
Mhm.
And then the next month you have 4, but the month
Right.
before you have 1. So, it would be interesting to know if somebody was coding those differently, those months, because that's a huge spread,
Yes.
right? So
Yeah,
anyway, I get
Yeah.
your point.
yeah, and so that's what, like, whether it's where they're pulling the numbers from or how staff are entering it, those are the pieces that we need to sort out with that. Yeah. Yeah, okay. There's not a whole lot else that's new this month. CARES, she did $3,250 in administrative fees were reimbursed. ICAP, she worked 72 hours this last month. As far as our office itself, the CART team for the impact program, the CART team is meeting weekly now. HSA is coming, so that's been a good addition. Working on getting somebody from the detention center would be incredibly helpful. They're not represented at the CART team right now, so that would be helpful if we can get them to buy in and be on board with that. The next place I'm going to reach out to is the hospital with that and seeing if we can get somebody from the emergency room to come to that as well. As far as the vehicle, we're waiting on the title from the DAV for the new vehicle. And so that's just, once we get that, then we can move forward with all of those pieces. We did send the payment for that. Nicole has submitted her resignation. And so that's a little bit disappointing or unfortunate. So, however, I was in contact with the Department of Health and they have guaranteed that the grant will be extended for another year. And so with that, that means we'll have a year and a half to continue to prove that position. The nice thing is I think we have the program ready to go. Getting somebody else on board, they can just get in and go. We don't have to do the building the program piece there. It's ready to go.
What about all the training that Nicole had to do at the beginning?
Yeah, so the person will have to be certified or go through that certification. They will pay for it again through the grant, if we hire, or, when we hire somebody new, they will pay for it again. If we hire somebody that's not already certified, ideally, we would have somebody that's already gone through the community health worker program that would be able to do it. However, if we do that again, I'm going to insist that they don't do it all at once. That was what they wanted us to do this with her, was to do the 40 hours at a time. And I think we lost some momentum during that.
Yeah.
And so the next person, we would have them do like one course at a time, 1 or 2 courses at a time, so they can see clients while doing the schoolwork, the coursework. So,
Kind of makes sense that way too. It's a building.
Mhm.
So are any of the Lake area students, is there a program over there that they could come
well,
over to this?
they
Yeah.
do, yeah,
CHW program. Yeah.
which is,
Could be helpful.
That was with Heidi.
mhm,
Yeah, that's right, yeah.
right.
Yeah.
And so one of my other agenda items is to have an intern from their program
Mhm.
for starting in January. So we do have a good working relationship for them. And so, yeah.
I just didn't know,
Maybe.
some of them are getting close to graduating.
Yeah.
If they went through that, they'd have that certification.
Yeah, yeah. So really looking to find the right fit for the program here and making sure that we get the right person in that program.
Right.
Going forward.
So
that
that
position.
training, that you said that they would
Mhm.
fund or whatever, that's not gonna come out of the grant dollars, that would be separate that they'll use, or is that gonna come out of the grant dollars that we've been awarded?
It is out of the grant dollars, but my understanding is if we are reaching our max on the grant dollars that they can.
Subsidize it?
Mhm.
Okay.
Supplement it.
Yeah.
Yeah.
It's not a
Subsidize.
hard fast limit is what.
Right.
Yeah.
Yeah,
Okay,
yeah, they can increase our amount
Alright.
if we need to. So,
all right.
okay, the interagency meeting last month, Judge Means spoke, which was great. We had around 40 people that attended, so that was fantastic. We meet again today, and today's meeting is a networking meeting just to talk about what's kind of going on in the community. Then as far as the strategic planning pieces, Angela has started, which has been incredibly helpful. Just having her be able to pick up the pieces and make sure everything keeps moving forward. The housing working group, we did receive confirmation that we received the grant for that emergency housing. And so that's very exciting. We're planning to have like a big community announcement, make it kind of a community event, hopefully at the end of November. I'm just finalizing a couple things before I start putting the date out with that. So please be watching for that. And it would be great to have your attendance at that event. Yeah, it's very exciting. With that, we're working on forming a new nonprofit organization and then the environmental assessment and all of the pieces to confirm that. The community transformation working group, we're waiting on the needs assessment grant or the grant that would fund the needs assessment. And so in the meantime, they're looking at some training, like developing a training plan for professionals, community members and clients. Kind of like they'd like to do a 3-level kind of training piece for our community to raise awareness about issues facing our community. And then mental health is working on a plan for school supports. We just met with some of the school psychologists yesterday and had a nice meeting with them.
Sarah, if you back up to that, so through that strategic planning, did some of those needs assessments get addressed in that or not at all?
Well, so what this needs assessment, what we did is we did the advisory council and really did a needs assessment with them.
Yeah.
And so this needs assessment would be for community members.
Okay.
And so like kind of our population served needs assessment with that more of a comprehensive needs assessment for like the people. Yeah. Rather than just us telling them what they
utilize
need.
Okay.
Yep. Yeah, and then the centralized services and community education, we have a proposal from ODNI that we'll be reviewing at our advisory council meeting in November 22nd. Our advisory council is meeting and we'll be reviewing that proposal from ODNI. So be watching for more on that. That will be exciting with that. And the child care working group, the survey is active right now. We're getting some responses. We found that Facebook has a lot of scammers. And so luckily they can weed them out. And so we're still have a goal of getting around 800 legitimate responses like that. And then just the collective impact, we're still waiting to hear from the grant on the South Dakota or from the South Dakota Community Foundation. And the goal with that would really be sustainability. How do we continue keeping this functioning moving forward?
Can I do you have a copy of that?
Of my report?
Did you, the narrative part?
No, I
you
didn't
can
have it.
email it.
I'll email it. Yeah, there wasn't a whole lot to, but yeah, I can email it to you. Yep. Yeah. So, and that's it.
Fantastic.
Anyone have any other questions? A lot going on.
Busy.
Yeah, it's good. It's good
Okay,
stuff.
so we'll move on then to item number 7, action to approve the welfare office client transportation procedures. So if you want to just give an update of the couple things that were tweaked from the other one.
Yeah, so here is the final draft for that. And basically, when we wrote this out, the way this policy, I contacted Minnehaha County to find out what Minnehaha policy is. And so I took their policy, adapted it for ours, and then Natalie reviewed it and incorporated the current policy manual in it. And so this is just for clarification, this will be the procedure piece for welfare officials to be able to use county transportation. This will go in the county welfare procedure manual.
Not the county.
Right.
Okay, not county.
Right.
Policy.
Yeah.
Okay.
So it will just go into our department procedure thing. And then we have reviewed it, which I appreciate. And just to make it more cohesive, letter U in there was what was
That was kind of my problem paragraph, but.
And that was a part that was brought in from the current policy manual to be incorporated in here. And so we made some changes. And so the one you have in your packet looks a little bit different from this one. And that's the main area. We wanted to have it be uniform, but also be relevant just to department specific.
It kind of, we might want to look at some of the wording of the county manual for some of this stuff, because I mean, they kind of brought it to my attention, but I'd make a motion to approve this one for the welfare office, so.
So,
Might be able.
oh, sorry. I'll second the motion for purpose of discussion.
So, just the things, I mean, there's some wording things that make sure that we know who's responsible to do what. And so a lot of times manuals have language like it will be done, it will be reported. And it's like, well, and who's going to do that? So
Right.
that kind of thing, it's pretty pretty simple stuff, but,
Mhm.
or basic stuff, I should say, but sometimes we just get used to certain kinds of wording and it's good to think about it sometimes.
Yeah.
So thank you for.
Yes.
Yeah.
So just for clarification, we have our county policy, which dictates or mandates employee use of county vehicles. Not mandates, but regulates, basically. Advises, guides, that sort of thing. Now, they will have a sub policy in their own.
They have their own policy. The welfare office does have their own policy as well.
So, and this,
This will not go into the county personnel. and
Okay,
policy
so-
manual unless, like Lee said,
But-
that.
This
just-
policy will not supersede our county policy.
So
No.
in a sense, welfare is adding, regulations to their own
Right.
policy.
Okay.
So they're still responsible to do the
Mhm.
county one.
Yeah.
This is
Gotcha.
more
Right.
specific, so it helps them to be
Got
more
it.
specific.
Because of their specific needs.
Right.
right,
Yes.
because
Okay.
this
Little
is,
different than what typically the other
Mhm.
county employees are doing.
this,
Difference of county policy.
yeah,
Yeah.
because this is specific to client transportation, and I don't think any of the other departments transport clients, and so we
No.
needed something
Others in law
specific.
enforcement and they're
Right.
covered under.
And they don't need.
Right.
that.
Yeah.
Yeah, so this was our regulating. how-
Those clients don't have to sign a waiver to be
No.
transported, right?
No,
Okay.
they,
Our special client.
Okay, okay, I got you.
Read it anyway.
Thank you.
yeah,
That makes sense. I like that.
Right.
yeah.
I
good.
do.
Yeah.
Yeah,
But
they
there
wanted
may
to have
be
it
some
covered.
Thanks for
things
looking at
that
overly.
we may end up tweaking in the
Yeah.
county policy,
Yeah.
just that we've
Mhm.
kind of learned through the process, so.
Yeah.
Clarification on a few things.
Yeah.
Yep.
All right, so we have a motion and a second. Do we have any other discussion? Not hearing any. All in favor, say aye.
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 Any opposed? All right, that motion carries. Now, your item number 8, action to approve a LATC intern agreement for the welfare office.
So I was contacted by a student in the community health worker program to do her internship this, their winter, spring semester. She would start in January and go through April. I should have written it down. It is 180 hours over that period of time. And so I had a discussion with her. I feel like she'd be a good fit. And so,
Move to approve.
Second by Waterman. Any other comments, questions?
And this is the non-paying internship, right?
Right,
Yep,
yes.
okay, so it does not cost.
That was my
Yeah.
question.
Okay, all right.
Yeah.
Yeah.
Sorry.
That's a good, that's
Yeah.
a fine
Sorry.
question.
well, I need to have her, that I'll have to look back on the insurance, the liability.
Well, when I was looking through this, it looks like it's covered in the.
They
in
do
the-
have a school policy.
Okay, yeah, we should probably have a copy of that. Yep,
Okay.
okay,
All right.
all right.
Okay.
Okay.
All in favor, say aye.
Aye.
Opposed, that motion carries as well.
Perfect.
That should be
Thank
it
you.
for you.
All right, great.
All
Thank
right.
you.
Thank you.
Thanks, Sarah. Thanks.
Have a good day.
You too. Okay, item number 9, action to approve the FY 2000, it's not 15. It'd be the FY. Competitive weed and pest grant
It says
application.
2015 on
I
the
know,
paperwork.
didn't he
This
send?
is not, this is the incorrect one.
Yeah.
He did contact me after the agenda was posted.
Okay.
No, the one that we are gonna do the competitive one next week, and I hope he's got the dates corrected.
Okay,
Today, we are doing the annual grant where we get about $5,000 in funding for chemical. It's the FY 24 weed test grant through the state of South Dakota. Department of Ag, that's the one we are doing today. Well, this competitive one will come
okay,
next week.
Okay, this is an automatic 5,000.
Yeah, and I
The
think I
other
just, I got a
competitive is
notice,
one-
I got a notice today that we received the amount from our last application, so.
Okay,
so this is the
So-
competitive weed and pest. That one's.
No,
gonna
this
be-
is not the competitive one.
Right.
This is just the annual one that we get. The competitive one, you have to meet certain
Yeah.
criteria and,
Well, isn't it the how many counties and how many
Yeah,
people
it's-
apply for it?
yeah.
There, it's, yeah.
So
Yeah.
that's-
$650,000 that was
Process.
split among
Right.
counties
And sometimes,
in 2015.
you know, yeah.
Yep.
So
No,
anyway,
there's
that-
certain-
we will do the competitive one and I will make sure he,
Yeah.
gets
So-
those dates
Yeah.
corrected.
So the one we're doing is not the one in the packet.
No,
Correct,
No, that's
exactly,
what I-
but he didn't notify me of his error until after I had sent everything
Do
out.
we have to put that can we act on that today or?
Yeah, it's a weed and pest grant. It's fine.
Okay.
So moved.
All right, motion
Second.
by Johnson, second by Van.
Go for it. I didn't see.
I don't want to second everything.
Yes, all right, motion, or second by Van Duzen. Any other comments, questions?
So just to review, this is a $5,000
2020.
It's an annual,
Okay.
our annual
All right.
application.
All right.
Yeah.
from the federal deficit.
Okay. All in favor, say aye.
Aye.
Opposed, that motion carries. Item number 10, we'll just leave on the agenda. We're getting really close on that to get those signatures.
I have no idea. I
Yeah.
really, nobody's contacted me on,
No.
I thought we were supposed to get a quick claim deed.
It's
I have
coming.
not seen that.
Yeah.
So, okay,
No.
good.
I've been in
There's a little-
conversation.
There's a little bit about their attorney wants
Okay,
some
trying to
extra
get the
stuff written in it.
signatures.
That's good.
Um,
I'm glad we're
Yeah.
not seeing that.
No,
Okay.
no, we're gonna move on.
Hopefully
All
that's
right,
true.
item number 11, canvas of the 2022 general election results and action to approve.
So Troy will read the results that are going to the Secretary of State's office. He is going to read the official canvas numbers. The numbers that you all have are the numbers that came off the ballot counter on election night. And I take those numbers and I input them into the state's reporting system, and that generates the report that Troy has.
So can I just on with a lot of people talking about,
Mhm.
counting and things like that. So what you're doing is you take the results up there and you manually enter them in the Secretary of State's thing. So you know exactly what's being sent and now.
Yes, and I
now
don't
we-
leave the office on election night until the numbers I've entered match what's on. So I did have a couple of errors when I was entering. A couple of times it was
Yeah.
keying entries.
So
There
now-
is a software available, but Codington County does not use it. I don't know if it would
think
justify the
it's-
cost. And it just raises more scrutiny.
I also think that, you see what you're putting in there and
Yeah.
now we're gonna triple check
Yeah,
what's going on and then we're.
Yeah.
Yeah.
So that's what.
That's the purpose of the
Because it was-
canvas.
Yeah, it was checked and
Just to
rechecked
finalize it.
and
Yep.
everything balanced that night and matched, so.
before we left the office.
Yes.
So
I can
Troy can
attest.
read the office, read the candidate's name and the total votes cast for each candidate.
Okay. General election occurred in Codington County on November 8th, 2022. In the race for United States Senator, Brian Bangs, 2,265. Tamara J. Lesner, 460. John R. Thune, 8,279. United States Representative Colin Duprell, 1,790. Dusty Johnson, 8,729. Governor and Lieutenant Governor Jamie Smith and Jennifer Kientz, 3,253. Tracy Quint and Ashley Strand, 307. Christy Nome and Larry Roden, 7,520. South Dakota Secretary of State Thomas A. Cool, 3,157. Monet Johnson, 7,162. South Dakota Attorney General Marty Jackley, 8,609. State Auditor Stephanie Marty, 2,836. Renee Meyer, 540. Richard Satgast, 6,857. South Dakota State Treasurer John Cunningham, 2,972. Josh Hader, 7,203. For Commissioner of School and Public Lands, Timothy Azur, 2,740. Brock Greenfield, 7,516. Public Utilities Commissioner Jeff Barth, 2,583. Chris Nelson, 7,729. South Dakota State Senator in District 4, John Wick, 1,159. South Dakota State Senator in District 5, Lee Schoenbeck, 6,743. South Dakota State Representative in District 4, Stephanie Sauter, 749. Fred Deutsch, 947. State Representative in District 5, Caden Mooney, 2,917. Byron Calise, 4,351. Hugh Bartles, 6,058. Codington County Commissioner, District 1, Raymond Johnson, 600. D. Lee Gable, 1,446. Codington County Commissioner, District 3, L. Myron Johnson, 1,394. Justin Peets, 949. Judge of the Circuit Court, Position A in the Third Circuit, Carmen Means, 5,535. Judge of the Circuit Court, Position B in the Third Circuit, Don M. Elsher, 5,620. Judge of the Circuit Court, Position C in the Third Circuit, Kent A. Shelton, 4,882. Judge of the Circuit Court, Position D in the Third Circuit, Gregory J. Stoltenberg, 5,154. Judge of the Circuit Court, Position E in the Third Circuit, Robert L. Spears, 4,741. Michael R. Moore, 2,387. And Judge of the Circuit Court, Position F in the Third Circuit, Patrick Party, 4,804. Supreme Court Justice Retention. Shall Justice Patricia J. Devaney, representing the Third Supreme Court District, whose term expires January 1st, 2023, be retained in office? Yes votes were 7,309. No votes were 1,551. Supreme Court Justice Retention. Shall Justice Mark E. Salter, representing the Second Supreme Court District, whose term expires on January 1st, 2023, be retained in office? Yes votes are 7,292. No votes are 1,509. On Constitutional Amendment D, an initiated amendment to the South Dakota Constitution which expands Medicaid eligibility. Yes votes are 5,506. No votes, 5,292. And initiated measure 27, an initiated measure legalizing the possession, use, and distribution of marijuana in South Dakota. Yes votes, 4,843, and no votes are 6,193.
All right.
That completes
so
the canvas.
I would look for a motion in a second.
Move to accept the findings.
Motion by Johnson,
Second.
second by Waterman. All in favor, say aye.
Aye.
Aye. Any opposed? That motion
And
carries.
I'd like to thank my new employee for preparing that list that Troy read off of. That will go to the Secretary of State. She's very
Cindy, just-
proficient at Excel.
Just for
Way to go.
clarification for the people that might read this,
Mhm.
the undervotes are the people that did not, were
That skipped the
eligible, but
race.
did not vote.
Yep, they skipped a race, like, a lot of the circuit court judge positions were unopposed. A lot of people looked at it and didn't see a reason to mark the ballot.
Does this include the people that voted but did not mark a ballot for that person?
Yep, there are, at the
Just
top
a
of
little
the sheet there, how
clarification
many
for the public.
total votes were cast? 11,230,
230.
and that's why each one of those categories adds up to 11,230, because it adds in the overvotes and the undervotes. So some people, for whatever reason, if there were two candidates, they marked both of them, that's an overvote.
I mean, we as commissioners understand this because we've been through it
Yes.
before, but
Yes,
for the general public clarification.
we don't quite understand why it happens, but it does. That
Yes.
people mark, yeah.
And it is, I mean, individuals, when you give them their ballot, I mean, anything they do not want to vote on.
I have 3 copies of the canvas that I'd like each of you to sign each copy so that I can get that mailed to the Secretary of State today.
All right.
Did we vote?
Yes,
Okay,
we did.
we did, that's right, yeah.
Okay, so item number 12, discussion possible action to enact a burn ban. I guess we do not have to worry about that.
Andrew and I have agreed to
Take it
take
off.
that off the agenda.
Yeah,
Yeah,
we should be good now.
Boy, that was a heck of a rain last night.
yes.
Yep.
Yeah.
Lightning.
Yeah.
Yep. Item number 13, action to approve claims for payment. Have and
Total claims were $1,799,287.57. Of that amount, $545,430.18 goes directly to the state of South Dakota for motor vehicle collection fees and other state fees, leaving the county's share of the claims at $1,233,857.39. I believe, yeah, the county highway department had claims totaling over $679,000 for some projects that were completed and also within this claim is our workers' comp. You can see in each department, there's an amount for workers' compensation insurance that will cover everyone for the calendar year 2023.
I'll make the motion to pay the bills.
all right, motion by Gable,
Second motion.
second by Van Duzen. Any comments, questions? Hearing none, all in favor, say aye.
Aye.
Aye. Opposed, that motion carries. Item number 14, action to approve automatic budget supplements.
None today.
Right, next we'll move on then to 15, action to approve personnel changes.
We have a new deputy state's attorney that has been offered a position and accepted. His effective date is 11/14 this month. Step 1, $6,119.58 per month.
What about?
I will move to approve.
Oh, did I put Tyler Barnes in there?
You put Tyler Barnes.
Okay, and Tyler Barnes has been hired as a part-time deputy sheriff for the pool at the sheriff's office. He was a former employee and Brad has seen a need to put another part-time one on, so. Tyler was here election night with us.
Move to approve those. Second.
Motion by Van Duzen, second by Gable. Any comments, questions? Hearing none, all in favor, say aye.
Aye.
Any opposed? That motion carries. Chopper requests, we don't have any of those. Possible quorum of commissioners, Sioux Valley Commissioners Association District Meeting, November 16th in DeSmit. Also tomorrow at 10:30, the Veterans Day Program. Out at the extension. Could be a possible quorum of commissioners. Anyone else have any?
So
Next week. Okay.
interagency thing is,
This afternoon at
this
2.
afternoon with the welfare
Yep.
office.
No, not
It's
the
at 2
welfare
o'clock,
office.
right?
It's at,
Was it, what's it, or the-
yeah, 2 o'clock, but it is out at Midwest Bible Camp.
Yeah. Yeah, that's what it is.
So that's all that I have. Anyone else have anything else? All right, let's move on then to old business. Is there any old business? How
Just,
about,
had a clerk meeting, nothing too exciting, a few expensive cases in other counties, so.
I guess I could just report that the Watertown Development Company had our board meeting yesterday afternoon and again, they expressed their appreciation of support to the county. So
very good.
lots of stuff that was talked about that I can't really talk about.
Yeah, things,
So-
things that are coming, but
Yeah.
in the works, but are
There's a
not
lot of stuff going
finalized
on in
yet.
this community and
Yes,
in
there
this
is.
county.
All right, how about item number 19, new business? Is there any new? Anything for the open? I know we do have a need for an executive session under contract negotiations, item number 3. Is there any other need? All right, I would look for a motion then to enter into executive session.
So move.
Motion by Johnson,
A second.
second by Gable. All in favor, say aye.
Aye.
Aye. Opposed? There will be no nothing afterwards
No action taken.
to, no action.
Sorry to put you on the exercise plan, Cindy.
No worries.
Stop us.
I need to do it now.
Yep,
So we can keep it up. I'll let you guys handle it.